For data collection, RBTs should gather materials, read the BIP, know what targets to run, and read previous session notes. Okay, the question wants to know, when should you do these things? All right. This is the first item, or one of the first items on the task list, preparing for data collection. RBT's primary role, implementation, collect data. Okay, you're going to implement the BIP, implement the treatment plan, collect data on that treatment plan. You need to be prepared because every moment we're with the client is valuable. We want to optimize and maximize the amount of time we're spending giving services to the client. So when you are preparing for data collection, when should you do that? Should it happen A, prior to session starting? Yes, okay. All your prep, all your planning, all your gathering needs to happen before session starts. When you get to session, you should be able to start session immediately, okay? If we look at B during the first 15 minutes of session, the problem with that is you're spending 15, 30 minutes of the client's time setting up. Some clients only get 2-3 hours, okay? Maybe 6-9 hours a week. They need to know that we are optimizing that time. So you need to gather all your materials, understand what you're running before session starts, not during the first 15 minutes of session. What about C? While the client is on break. Again, you should have already been prepared before session started, okay? Not when the client's on doing their own thing, right? You may need to manage behaviors. You may need to engage with the client. So if you're counting on client break time as your time to prepare, okay, that's a bad bet. You need to be prepared before session starts. And then while receiving supervision with their BCBA, well, when you get supervision, that's when you ask questions. That's when you get clarity on stuff you might not be sure about. All right, but as far as preparing for data collection, which is on the task list, that needs to happen prior to session starting. Question 2, you and your friends are driving in your car on a road trip. You all start talking about the Italian restaurant you went to on your last road trip. Suddenly, everyone in the car is craving Italian food. The conversation is functioning as a what? Okay, so when we're looking at measurement questions, behavior questions, SD questions, we need to first identify what part of the question are we analyzing. In this question, you're on a road trip, you're having a conversation, you're craving Italian food. We're looking at the conversation. So we're looking at the part that says, start talking about the Italian restaurant you went to on your last road trip, okay? So what is that? Well, that is the antecedent to what? It's the antecedent to you craving Italian food. So you know it's an antecedent, right? What can you eliminate? You can obviously eliminate consequence. It's not the consequence of anything, okay? You're having a conversation, the antecedent to craving Italian food. So now we're looking at the SD, the MO, or the prompt. Does the conversation prompt you to do anything? No, right? Craving, okay, is this internal thing, right? We're not prompting anybody to crave anything, okay? So we can eliminate prompt. That leaves us with MO and SD. Now, what is the difference between an MO and an SD? An MO comes before an SD, and it's going to make you want or not want a consequence. An SD signals a consequence is available. It's an important distinction. You may be motivated for something, you may want something, but until there's an SD, it's not available, okay? So in this case, what happens? You talk about Italian restaurant, you talk about Italian food. Now you want Italian food. You're craving Italian food. The motivation to gain Italian food has gone up. Is Italian food immediately available? No, you're in the car, you're on a road trip. There is no SD for Italian food. However, the motivation is now there. Understand that distinction. Again, an MO makes you want or not want something. It changes the value of a consequence. The SD says, okay, that consequence is now available. All right, so this is an MO. Talking about it makes you want Italian food. It increases the value. Not until you see, let's say, an Italian restaurant, do you actually see an SD for Italian food. So the conversation is functioning as an MO. An RBT arrives at a client's home for the first time. The RBT has never worked with this client before. The RBT received training on the BIP and treatment plan and brought potential reinforcers with them based on the preference assessment conducted at the initial assessment. As soon as the RBT walks in, the RBT says, "Okay, let's get to work," and the client runs off screaming. What did the RBT fail to do? Up to the point when the RBT walks in and says, "Let's get to work," it seems like everything was going pretty well. The client or the RBT had training. They know the BIP, they know the treatment plan, they brought reinforcers based on the initial assessment. But what mistake did they make? Okay, what did they fail to do? Did they A, read the BIP? Well, yeah, they got trained on the BIP, so they know the BIP. Okay, that's good. That's obviously before you get to the client's home, part of the preparation is training on the BIP. The RBT has done that. Understand the treatment plan. There's no indication the RBT doesn't understand the treatment plan. The RBT was trained on the treatment plan. They brought reinforcers or potential reinforcers based on the assessment. By all accounts, the RBT seems to understand what they're trying to accomplish. However, what did they fail to do? They failed to build rapport. What is building rapport? Building rapport is developing a relationship with the client. It's getting to know the client. It's treating the client with dignity and respect. You don't just walk into a client's home, their environment, and start telling them what to do and expecting them to just do it. We need to establish a relationship. You must build rapport. When the RBT walks in and just says, "Let's get to work," without ever even getting to know the client, they have failed to build rapport. C looks like our best answer. What about D? Choose the right potential reinforcers. Well, as far as they know, these are the right ones. It's based on their assessment. So until they learn more, these are what they know to be the best reinforcers. The best answer here is the RBT failed to build rapport. The Super Bowl is happening in just a couple of days. The family you provide services to 5 days a week invites you over for their Super Bowl party. How should you respond? So this is a situation that might occur in the next few weeks. The Super Bowl is coming up. RBTs who've worked with clients for a long time, they sometimes get invites to parties, sometimes get invites to gatherings. Okay, you kind of become part of the family in some ways. They depend on you, they rely on you. However, how do you respond in those situations? What should you do? Should you A, accept the invitation? It would be rude to decline. So immediately we know what? Immediately we know we are not accepting this invitation. Why not? What is that term? The term is dual relationship. We're trying to avoid dual relationships whenever possible. By accepting the invitation, okay, we're now starting to engage in a potential dual relationship. That's when our personal and our professional lives cross over. We have to avoid that. So we know we're not accepting this invitation. We can eliminate A. We can also eliminate B, accept the invitation but cancel last minute. It's probably worse. You don't want to give them the expectation that you are coming and then not. We're not accepting the invitation, okay? So how do we decline? Do we C, decline the invitation and report the family to the insurance company? Family hasn't done anything wrong. The family's not under an ethical code like we are. So the family's just being polite. They're being nice, right? Maybe they want you there. So no need to report them. What we need to do is decline the invitation and inform your supervisor. Task list says no dual relationships. Task list says communicate promptly, quickly, effectively with your supervisor. Maybe nothing comes of it, but you still want the supervisor to be aware that this has happened, okay? We're trying to avoid these dual relationships at all costs. How do we determine if consequences are reinforcing or punishing? So we know in ABA, when we choose a punisher or a reinforcer, we're not going by what we consider traditional technologies. A traditional technology would be a reprimand. Traditionally, a reprimand is always viewed as punishing. Traditionally, a chocolate bar is always viewed as reinforcing. In ABA, we don't judge it based on the formal look of the stimuli we're presenting. We judge it based on the effect of behavior, okay? So in order to determine if consequences are reinforcing or punishing, what do we need to do? A, we evaluate consequences based on the behavior that precedes the consequence. Do we evaluate consequences based on the behavior that we react to? So a consequence follows a behavior. Do we evaluate the consequence based on the behavior it follows? No, okay? We're not worried about current behavior. So if we look at B, we evaluate consequences based on the impact it has on current behavior. We're not worried about current behavior. Consequences don't impact current behavior. Consequences impact future behavior. So if we look at C, we evaluate consequences based on the impact it has on future behavior. Yes. A client engages in a tantrum. We send them the time out. In the future, those tantrums decrease. Now we can determine that consequence is punishing. We're always worried about the impact of our consequences on future behavior. That's very, very important, okay? And then D, we evaluate consequences based on how the client feels about the consequence. Regardless of how the client feels, the client may love timeout. They might think it's great, but if their behavior decreases, it's still considered punishing. Same as the client may hate chocolate bars, okay? But if the future behavior increases, it's still reinforcing. What we're concerned about is how the consequences affects future behavior. That's how we determine if consequences are reinforcing or punishing. It's a very important concept to understand. What preference assessment is commonly used to establish a preference hierarchy? Okay. There's a very specific preference assessment that is associated with establishing a hierarchy. What is a hierarchy? We're trying to determine if we have 4 stimuli, what stimuli does the client like the best? What stimuli does the client like the worst, et cetera, et cetera. What preference assessment is going to be best at that? A, single choice. Single choice is not effective at establishing a hierarchy. All you're doing is handing single items to the client and recording their engagement with that item. We're not establishing a hierarchy. We're not establishing an order of preference. You're just simply looking at individual items in a bubble. Single choice is not good at establishing a hierarchy. What about paired choice, forced choice? Yes, the most common preference assessment associated with a hierarchy is going to be paired choice / forced choice. If I have 4 stimuli, I'm going to present 2 stimuli at a time. I'm going to record which one the client chooses. We're going to repeat that until every stimuli of those 4 have been presented together, and we get an idea of what the client likes the most, what the client likes the least. The best preference assessment to use is a paired choice when looking for a preference hierarchy. If we look at multiple stimulus with replacement, that would be, let's say we have 5 stimuli on a table. Whatever stimuli you choose, I put back and I replace the other 4. So if it so happens that the client loves that first item, okay, we're only comparing that item against other items. They might just pick that one every time. Whereas forced choice, we're switching out all the items and we get an idea of what item they like better than other items. So paired choice is still better than that one. And in naturalistic, of course, you're not manipulating anything. You're just observing naturally. It's not going to do a great job at establishing a hierarchy. The best preference assessment to use when you want to establish a preference hierarchy is paired choice or forced choice. Your supervising BCBA instructs you to record occurrences of behavior throughout your entire session. What type of measurement is your BCBA asking you to use? Very easy question. Not every question on the exam is going to be super difficult. When you get an easy question, don't overthink it. Okay, you've prepared, you're ready, you're confident. Choose the best answer. Choose the answer that you know, and then move on. Okay. Once you get really good at the exam, you can answer the easy questions quickly, giving you more time for the hard questions. So in this case, when you record every occurrence of behavior in your entire session, what type of measurement are you using? Obviously continuous, right? Continuous measurement is recording every occurrence of behavior. This continuous, we're not recording every occurrence of behavior. We're recording in intervals. So if we look at D, we can also eliminate interval recording. And then permanent product, we're not measuring the occurrence of behavior. We're measuring the outcome or the product. So if you want to record every occurrence of behavior throughout your entire session, you're going to use continuous measurement. Again, straightforward, simple question. Don't overthink it, okay? Trust your preparation, pick the best answer. If your client frequently engages in escape-maintain behavior, what type of task chain procedure might be most appropriate to use when teaching a skill? We have all our different types of task chainings. We have forward, backwards, total task, and then behavior chain interruption strategy. Our client engages in escape-maintain behavior. What does that mean? It means when you present them with the demand, they try to get out of it. They try to escape it. They try to avoid it. If we know that, what are we going to use? Will we use forward chain? Well, think about how we implement forward chaining. What do? You say, here's our task. Complete the first step to gain reinforcement. Well, that's exactly what's going to trigger this escape maintain behavior, presenting an SD, presenting a contingency. Forward chaining is not going to be preferred for escape maintain behavior. What about backwards chaining? Backwards chaining, we're going to say, okay, we're going to do this task together. Once we complete it, once you do the last step, you get reinforcement. Backwards chaining uses escape as reinforcement, okay? Because we're prompting through the whole task, we're working together, and only once they complete that last step do they get reinforcement, they get to escape. Backwards chaining is going to be best for escape maintain behavior because escape functions as the reinforcer for completing the task. It's the best method to use in this case. Total task chain means you're doing the entire chain, or the client is doing the entire chain. Again, you're presenting the SD, which is going to trigger escape maintain behavior. Behavior chain interruption strategy, you're actually interrupting them in the middle of the chain, which is perhaps going to be the worst thing for escape maintain behavior. So if you want to use chaining, but your client engages in escape maintain behavior, typically we want to try and use backwards chaining, where escape is going to function as the reinforcer for completing the final step. Why is it important that we collect baseline data before implementing an intervention plan? What is baseline data? Baseline data is data we collect before we start our intervention, okay? What is baseline data going to tell us? Baseline data is going to tell us, do we need to do the intervention? Do we actually need to implement anything? It's going to give us a comparison tool for when we actually do implement the intervention. Is our intervention working? Okay, so knowing that, let's try to pick a good answer. Why is baseline data important? A, baseline data will let us know if an intervention is needed. Yes, that's what we just predicted, right? If we're trying to reduce a behavior and we take baseline data and that behavior is already reducing on its own, or it's happening at a very low rate, intervention might not even be needed, okay? So baseline data is going to help us or prevent us from implementing an intervention that's unneeded. A looks like our answer. Do we just pick A and move on? No. What do? We read all of our answer choices. We want the best answer. B, baseline data gives us a reference point when evaluating the intervention plan. That's also true. Once we implement our intervention, we can now compare our intervention data to baseline data and see how effective it really is. Okay, that's really the point of baseline data. Is our intervention even working? If we don't have data before the intervention starts, how do we know if it's actually working? Okay, evaluating it using a comparison is our best bet. A and B both look good. What about C? Baseline data helps us choose a measurement procedure. No, not necessarily. If you're taking baseline data, you're already using a measurement procedure. The measurement procedure is already chosen. Okay, baseline data is not going to help you choose that. So what is our answer? Well, A looks good, B looks good. Let's look at D. Both A and B, yes. Both A and B are sufficient reasons why we use and collect baseline data before implementing an intervention plan. Always, always, always read all of your answer choices, pick the best answer, understand why the wrong answers are wrong. Okay, last one. After one session of implementing a new behavior plan, you believe that there are some issues with the intervention you are using. What should you do? Okay. As an RBT, your opinion matters, first and foremost. Do not forget that. If you ever get a supervisor who doesn't listen to you, who doesn't respect your opinion, find a new supervisor. Good ABA, successful ABA is all about teamwork, collaboration. As an RBT, you need to be communicating constantly with your BCBA. In this case, you implement a new behavior plan and you think there are issues with the intervention you are using. How do you respond? What do you do? A, continue using the plan for a couple more sessions to be sure. This is one of the worst things you can do, the try it out, figure it out approach. We don't just figure it out, okay? If you think there are issues, don't keep using the plan to try to make it work, okay? We need to do something immediately. B, change the intervention to better suit your goal. Is that your job to change the intervention? No. It's your job to report issues with the intervention. It's your job to assist with changing the intervention, but you can't just change the plan because you think you should, right? That is still your supervisor's job. So B is inappropriate. C, inform your supervisor of your concerns. Absolutely. When in doubt, pick the communication question. In this case, you've done one session with the new behavior plan. You think there are issues. You tell your supervisor. Now, they might say, hey, continue using the plan, see if it works. But at least you inform them. The worst thing you can do is not say anything, continue implementing it, something goes wrong, and then you realize, oh, I realized this was going to happen. I didn't say anything. At least you can document you tried to inform them of your concerns. Always, always, always openly communicate. And then D, inform the parent. No, the parent's not going to be any help. They don't design the behavior plan. Your supervisor does with your help. Okay, thanks for watching. I appreciate it. Please like and subscribe. If you're looking for study materials, check out RBT Exam Review or BCBAstudy.com. We are going to be back Wednesday with more practice questions. Till then, any questions, please let me know. Study hard, work hard. See you soon.